Amaya Manning just turned 1. She's an absolute delight for Mom and Dad, Sean and Amber.
Yeah, she's a beautiful baby girl, and just really glad that I'm here to enjoy the time with her.
Amber almost wasn't here. Complications during Amaya's birth very nearly took her life.
Amaya's vitals kind of kept dropping, so they decided to do an emergency C-section.
At first, everything was going good.
You know, from there, I guess things kind of took a turn for the worse.
Sean recalls getting news that Amber was hemorrhaging badly. He was asked to approve an emergency hysterectomy to try to save her life.
We need you to give us permission to do an emergency surgery. And I'm like, well, what's going on? And she said that they couldn't stop the bleeding.
And I immediately looked at my partner and said, we should tell the pilot to get the blood.
Tricia Riggett is a flight paramedic for Mayo Clinic's air ambulance service, Mayo 1. She was part of the medical crew that rushed to transport Amber to a trauma center.
This is our blood cooler here at Mayo 1.
After a vital stop at the hangar's blood supply refrigerator.
We take this on every flight, no matter what kind of flight we're going on, so no matter where we go, we automatically put it in the helicopter and take it with us. We have 3 units of thawed plasma and 3 units of packed red blood cells in our blood cooler. You need to replace both in someone in Amber's condition.
Amber was bleeding so badly that even the 15-minute flight from the small regional hospital would have been too far without the blood products on board.
We're like, we need to get as much blood in her as we can, like, immediately.
I don't think she would have survived under other circumstances.
Mayo Clinic Hospitals became the first in the country to carry packed red blood cells on its helicopters in 1988.
It's the right thing to do for our patient population, especially when there's longer transport times. It is a commitment both on resources, personnel, training, education, safety. There are many factors that go into this.
In 2009, Mayo Clinic added thawed plasma on all its flights as well, hoping to save even more lives.
It's uncommon. We were the first civilian institution in this country and the world to carry thawed plasma.
Over 1,000 patients since that time, since 2009, have benefited from pre-hospital administration of plasma.
Dr. Donald Jenkins is the trauma director at Mayo's St. Mary's Hospital.
Far more non-trauma patients are benefiting from this change in practice than trauma patients. That goes to Amber's case precisely.
Once in the hospital, Amber also needed platelets and coagulating blood clotting agents to help control her bleeding. By the time surgeons were able to stop her hemorrhaging and get her on the road to recovery, her total body blood volume had been replaced 4 times over.
You know, once we start getting those work status reports.
Ironically, Amber is a Mayo Clinic Human Resources employee assigned to hospital operations and the Mayo 1 and Emergency Transport Services team that saved her life. Needless to say, she made a trip to the helicopter hangar to thank the flight crew personally.
I got a big hug.
You know, I don't think there's enough words to express how grateful I am, and I'm just in awe of what they do each and every day.
For the Mayo Clinic News Network, I'm Dennis Douda.